the minister, returning from his overseas trip, continued a strident defense, putting out several videos that are still available to be viewed online, in some instances ridiculing and mocking me and my accusations.
Loyal viewers and subscribers, bless up, give thanks for life. Give thanks for your continued support. Today on the Avenue, we will be looking at Dr. Alfred Dawse, real revolutionary for the people. Yeah, as he explained a neurological surgical drill that was bought by the health sector for Bustamante Children's Hospital at a cost of $31 million. Some people, he is stating that that is not the original or the true cost for it. And from what he's saying, he's explaining that there is corruption, mix up, and all kind of negative transaction took place here. Some people, let's get into it and hear what he got to say and hear his explanation. And in the meantime, leave your thoughts and views in the comment section and let us have that discussion. New viewers, forward to the Avenue. Don't forget to like, share, and subscribe to the channel. Thank you very much. Let us get into it and hear what Dr. Dawse got to say.
Good morning. I'm Dr. Alfred Dawse, the opposition spokesperson on health and wellness. Over the past year or so, my colleagues and I have been shedding light on some of the issues affecting the healthcare sector. Specifically, we have placed an emphasis on transparency, accountability, and voiced concerns about the continued misuse of the public's funds in the Ministry of Health. Our concerns stem from issues that you have experienced and voiced to us. Our concerns come from stories that have been played out in the media in recent times. Most recently, and specifically to the Bustamante Hospital for Children, we have seen where we had a baby die waiting on a ventilator. We have seen a visiting team who had volunteered and brought essential equipment come to the Bustamante Hospital for Children to perform scoliosis surgeries on children who are suffering from a debilitating disease, living in severe pain, where their only hope of affording such quality surgery would have been as a result of these missions. We have seen one such mission cancelled because of the dilapidated state of the operating theaters at the Bustamante Hospital, where the AC units were non-functional. This morning, the father of Alexandriana Jones asked me to keep her story alive. I had no operating microscope to assist him in such a complex surgery. And when complications developed, Alexandriana had to be put on an ambulance and sent to the Kingston Public Hospital, losing valuable hours to get a CAT scan done to see what was the next course of action that was necessary to save her life. This because there is no CAT scan at the leading children's hospital in the Caribbean, and has been the case for many years, known by those who could have made a difference. We have heard stories about the ENT teams not having adequate equipment, and thus surgeries are being postponed. We have heard stories about mothers, fathers having to sleep in chairs because the overnight facility that was supposed to be built with the Shaggy Foundation funds has not been completed. We hear about the long waiting times of waiting in chairs in the emergency department and of overcrowded clinics. And this is why we have continued our advocacy for improvement in healthcare. We are going to be focusing specifically on one piece of evidence that we have found corroborates what we firmly believe to be a web of corruption within the Ministry of Health. And in this instance, it concerns a neurosurgical drill. Attention was first brought by Senator Lambert Brown in January where he questioned the expenditure of $31,500,000 on a single neurosurgical drill. The Southeast Regional Health Authority denied that the price was inflated and that this was a reasonable price for a quality drill, the first of its kind in Jamaica and possibly the only type in the Caribbean. I reiterated that call for the justification of that expenditure because all research pointed that this drill should have been procured or could have been procured at a much lower price. Following a meeting with the SERAHA chairman, I had to call for his resignation based on his stubborn defense of what was a flawed procurement process. I saw the procurement documents. I saw where the process was hijacked, where an internal source determined that a fair price for that drill was 32 million Jamaican dollars. So purchasing it for 31,500,000 was a discount to taxpayers. The minister, returning from his overseas trip, continued a strident defense, putting out several videos that are still available to be viewed online, in some instances ridiculing and mocking me and my accusations. But we do have evidence that this drill is only the tip of the iceberg of corruption within the Ministry of Health. In November last year, just before the drill was purchased by SERAHA for the Bustamante Hospital for Children for $31,500,000, two drills of the same type, EM200, same manufacturer, same specifications, same model numbers, were brought in by one company, the company that won the bid to supply that $31 million drill. On their customs declaration forms, accompanied by an invoice from the manufacturer, we see that it was not a new drill. They were refurbished drills with a purchase price of $1,600 US. That was the declared value, and they paid $90,000 in customs fees, bringing the grand total landed the same drill, model number, specifications, landed in Jamaica, cost nowhere close to $31 million, but 250,000 Jamaican dollars. We have the serial numbers for both drills. The question today, we have two questions. The company that brought in these drills won the bid to supply the exact same drills to SERAHA. It cost the company $250,000 to have that drill in Jamaica. Is the $31 million drill at the Bustamante Hospital for Children one of these drills that were imported in November last year? Yes or no? If it is a case where the drill that was purchased from the same company just after these two drills were imported is a different drill, what was the justification for paying $31 million for a drill that could have been bought and landed in Jamaica for less than 300,000 Jamaican dollars? Is that a fair price? Understanding that the same company that won the bid could have brought in a drill for 1,000 times less. This is not about politics. This is about the blatant misuse of taxpayer dollars. The question is further compounded what could have possessed someone to spend $31 million on a drill when they could have bought 100 of those same drills, when they could have bought a CT scan so babies and children would not lose valuable time and increase their chances of complications and dying if they did a CT scan at Bustamante Hospital rather than going to Kingston Public Hospital to have a scan done. Why spend $31 million on a $300,000 drill when you could have purchased several ventilators so less babies would have been dying? $31 million versus fixing and maintaining your operating theaters so life-saving surgeries can go on uninterrupted, so that missions coming to Jamaica to volunteer their services can help those children suffering in pain. Why? And that is where I'm going to leave the question. Why do it? I'm not going to call for anyone's resignation today. Let the chips fall where they may. There's obvious corruption, blatant mismanagement taking place in the Ministry of Health. I have one more thing to add. The company, and this is further evidence of what looks bad, the company in question is owned by JLP Member of Parliament Donovan Williams, the MP for Central Kingston, a man whose name may be familiar not just as MP, but as a company secretary linked to Estate Bridge, a company in turn linked to Prime Minister Andrew Holness that was under investigation by the Integrity Commission. Is Mr. Williams able to state, to answer these questions, is Mr. Williams able to say his hands are clean? If that is the case, then he should present himself. There should be a release answering these questions. And as I said, the chips must fall where they may. But we do know that there is a web of corruption, and it is paid for in the suffering and death of children and babies. If this is not evil, I do not know what is. I don't know who in the government, from top to down, has the moral authority to call out and weed out those who are involved in this blatant theft and rape of an industry, of a system so vital to us as a health sector. We're asking Jamaicans to be outraged. We're asking you not to let this die, because if you do, the blood of innocence will be on all our hands. I have two files, two dossiers, one addressed to the Auditor General, Mrs. Pamela Monroe Ellis, with the findings of our investigation. The other is addressed to Mrs. Justice Reed, retired Justice Carol Lawrence Beswick, the chairman of the Integrity Commission. We're asking for a fulsome investigation into the procurement process of this neurosurgical drill, and that we see a definitive message being sent and justice being served for all those children, babies, and their parents who have suffered because they have lacked equipment and services, while money has been sucked out of the Ministry of Health, out of Bustamante Hospital, out of SERAHA, by what I had referred to before as a rapacious form of capitalism enabled by corruption. Thank you. Aluta continua.
Thank you, Dr. Dawes, for that very informative presentation.
As you can hear, my people, that's all for now. What is your thoughts and views on all of this? Leave them in the comment section and let us have that discussion. If you're new here, forward to the avenue. Don't forget to like, share and subscribe to the channel and watch the videos. Thank you very much. Catch you in the next one. I'm out for now.